Good afternoon. Thank you very much for joining us again today. I want to start with the usual statistical update on COVID-19 in Scotland. As at 9 o'clock this morning, there have been 12,924 positive cases confirmed, which is an increase of 215 from yesterday. A total of 1,587 patients are currently in hospital with either confirmed or suspected COVID-19. That is a decrease of 45 since yesterday. A total of 86 people last night were in intensive care with confirmed or suspected COVID-19, and that is a decrease of 3 since yesterday. I'm also able to confirm today that since the 5th of March, 2,954 patients who had tested positive and been admitted to hospital for the virus have now been able to leave hospital, and I wish all of them well. Unfortunately, though, I also have to report that in the past 24 hours, 59 deaths have been registered of patients who had been confirmed through a test as having the virus. And that takes the total number of deaths in Scotland under that measurement to 1,762. As always, let me stress that these numbers are not statistics or just statistics. They represent real people whose loss is being felt and mourned by many. And I want again to send my deepest condolences to everyone who has lost a loved one to this virus. We are all thinking of you. I also want to thank again our health and care workers for the extraordinary work that you're doing in these most difficult of circumstances. And I want to thank all of you watching at home for the sacrifices you are continuing to make as you follow our very clear advice to stay at home, save lives and help us to continue to protect the NHS. Now, I have one main point that I want to update you on this afternoon. As I have indicated previously this week, the Scottish Government is legally required to review the regulations giving effect to the lockdown every 3 weeks, and the latest review falls due today. Our assessment of the evidence leads me to the conclusion that the lockdown must be extended at this stage. More detail of our analysis will be published alongside today's daily statistics at 2 p.m. But let me say this now. We are together making really significant progress in our efforts to get this virus under control. I have reported today a further reduction in the number of patients in intensive care, and yesterday National Records of Scotland reported the first weekly decline in the number of registered deaths related to the virus since this outbreak began. All of that gives us real hope and real encouragement. But we also know that progress remains fragile. Our estimates suggest that there are still significant numbers of people in Scotland infected with this virus. And we're not yet confident that the all-important R number is comfortably below 1. And I've explained and set out before why it is so important to get it and keep it comfortably below 1. Indeed, we think it could still be hovering around 1 just now, which means that any significant easing up of restrictions at this stage would be very, very risky indeed. Also, we think that the R number might still be a bit higher here than it is in other parts of the UK, perhaps reflecting the fact that our first cases came later than England's, and so we may be at a different and slightly later stage of the infection curve. Now, all of that tells me that extreme caution is required at this critical juncture to avoid a rapid resurgence of the virus. Before we can judge that it is safe to begin any significant, albeit gradual, easing of the restrictions, we want to see data in the days ahead that confirms a very clear downward trend. In particular, I want to see what our estimates of new cases and the R number look like a week from now. And I will be looking very carefully, as I'm sure all of us will be, to see if next week's NRS figures show a continued fall in the number of deaths. And it is to allow for such further careful assessment that we have concluded that the lockdown and the associated regulations must remain in place for now. The legal deadline for the next review of these regulations will be 3 weeks from now, which is the 28th of May. But I want to be very clear again today that we can make changes to the regulations before then if the evidence suggests that it is safe to do so. And let me say again, I am as anxious as anyone is to restore some degree of normality to our lives as soon as possible and to reduce the harms that we know lockdown itself is doing. It is also open to us to amend the supporting guidance if we think that is possible. And indeed, there is one very limited specific change to the guidance that we are considering already, and I want to come back to that shortly. But first of all, I want to address reports that you might have seen in today's media that the Prime Minister might be planning on Sunday to announce changes to the lockdown in England. I should stress that these are only media reports. I do not know yet how accurate they are. And before I go any further here, I want to take the opportunity to remind you that none of the decisions that I am taking just now, absolutely none of them, are driven by politics. They're driven only by doing what is right to tackle this virus and to save lives. And I believe that is true for all leaders across the UK. However, I have to be clear with you that the potential changes that are reported in the media today have not yet been discussed with the Scottish Government, or as far as I know, with the other devolved governments. I hope we will have discussions in the next few days. We had expected a COBRA meeting today or tomorrow, but it seems now that it might not take place until Sunday, which of course is the day the Prime Minister is due to make his statement. However, in the last half hour, I understand that the Prime Minister has requested a call with the devolved governments later today, and I very much welcome that. And if and when those discussions do take place, I will make very clear, as I have all along, that it is my preference, if possible, for all 4 UK nations to make changes together at the same pace, because that certainly helps us give clear, consistent messages to you, the public. However, for that approach to work, we must agree to make changes only when all 4 governments are satisfied that they don't risk a resurgence of the virus. And again, let me be clear, if the Prime Minister decides that he wants to move at a faster pace for England than I consider is right for Scotland, that is of course his right. I will respect that and I will not criticise him for doing that. But I hope you understand, and indeed I hope you agree, that I must make judgments informed by the evidence that are right and safe for Scotland. I will not be pressured into lifting restrictions prematurely before I am as certain as I can be that we will not be risking a resurgence of infection rates. Now, of the changes that are floated in the media today, there is only one that I may, and I would stress at this stage, may be prepared to agree to in the immediate future, and that is a change to the guidance limiting outdoor exercise to once a day only. That is currently, as you know, one of the limited number of reasons that you are permitted to leave home. As I alluded to earlier in the week, we are already considering whether it would be possible now, without increasing the R number, to permit you to exercise outdoors more often than once a day, but on the strict conditions that you still stay within your own household group, stay 2 metres away from others, and stay reasonably close to your own home. It would, and let me stress this point, it would not change the overall message to stay at home except for the limited reasons of exercise, food and medicine. We will report back on our consideration and indeed any 4 nations discussion of that over the next few days. In the meantime, however, let me be clear that the once-a-day rule does remain in place. The other possible changes that are reported in the media today, such as encouraging more people back to work now, or opening beer gardens, or encouraging more use of public transport, would not, in my judgment, be safe for us to make yet. And I particularly strongly believe that for us to drop the clear, well-understood stay-at-home message right now could be a potentially catastrophic mistake. Now, there's discussion in many countries about the timing of lockdowns. All along, we have taken the decisions we considered right and at the time we thought right, and that's what we will continue to do. And of course, none of us have the benefit of hindsight when we make those decisions. But right now, we do have the benefit of foresight. And what I do not want a few weeks from now is for us to see a resurgence of this virus and for you to be asking me this: why on earth did you start to ease lockdown a week or a couple of weeks too early? It's not an exaggeration to say that the decisions we take now are a matter of life and death. And that is why they weigh so very, very heavily. and it's why they must be taken with great care, and it is why, as I take them, I will continue to err on the side of caution. Now, I will keep you updated of any and all discussions with the UK governments, other UK governments over the weekend. For now, though, the advice remains the same as it has been. It is easier for us to start emerging from lockdown the lower the R number is and the fewer infectious cases that there are. And so for all of us, the way in which we emerge from lockdown that bit more quickly is to stick with the current restrictions now. So please stay at home except for essential purposes, such as exercise or buying food or medicines. Stay more than 2 metres from other people when you are out, and do not meet up with people from other households. Wear a face covering if you're in a shop or in public transport, and isolate completely if you or someone else in your household has symptoms. I know that these restrictions are very tough, and I also know and worry that any talk of easing the lockdown might make it more tempting to go out that bit more often. But please resist that temptation. Stick with the current rules. We must, absolutely must protect the progress that we have all made together so far, because it is by doing that that we will continue to slow down the spread of this virus, continue to protect the NHS and continue to save lives. Thank you very much indeed for listening. I'm going to hand briefly to the Cabinet Secretary for Health before I and of course the Chief Medical Officer take questions from journalists.
Thank you very much. As the First Minister has said, we are all as anxious as anyone else to see more normality restored to our lives and reduce the harms that we know lockdown is doing. Given the sacrifices that we are asking many people to make in these extraordinary times, the government has a duty to support people who are isolating as best as we can. Even before COVID-19 came into our lives, tackling loneliness and isolation was already a key priority for this government and a personal priority for me. We know that becoming disconnected from those around us can have a serious limiting effect on our physical and mental health, issues which of course have been thrown into the spotlight during this pandemic, particularly for those who are shielding and in a high-risk group. And during these last few weeks, I think all of us have developed a newfound appreciation for being digitally connected, whether that is keeping up with local news, being able to remain in contact while physically apart from family, loved ones and friends, or using those digital connections to access resources to help us with our mental health or well-being. But we also know that many people are still excluded from that digital world. And now more than ever, we want to see them get online and stay connected. So today, the Scottish Government is unveiling a £5 million programme to help bridge that digital divide. The Connecting Scotland programme will offer an internet connection, training and support, and a laptop or tablet to people on low incomes who are considered clinically to be at high risk and who are not already online during this current pandemic. Those who take part in the programme will be paired with a digital champion or buddy to support them for 6 months while they get connected, find the information they need, and gain confidence in using what so many of us take for granted. Prior to this rollout, the Scottish Council for Voluntary Organisations has been trialling this approach with Glasgow Disability Alliance and Govan Housing Association. And the success of the pilot has made clear that this investment will bring significant benefit to a number of individuals. We expect it to bring about 9,000 people online over the coming months. That's 9,000 people who would otherwise not experience the benefits of the digital world. We know that shielding is absolutely critical for a group of people who are clinically at high risk of very serious illness indeed if they contract this virus. But we also know that they are the group of people we are asking to take the hardest steps of all. So anything that we can do to support them, to help them remain connected, to help with mental health and well-being, we will do. And if there are other steps that we can take, be assured that we will take those.
Thank you very much, Health Secretary. I'll go now straight to questions. The first question today comes from Sharon Donaldson from STV.
Ending this lockdown, how will that go down with the public if indeed measures are eased elsewhere in the UK?
I think what the public expect me as First Minister to seek to do is arrive at judgments that are in the interest of keeping them as safe as possible. I don't want lockdown to be in place for any longer than it has to be. I've been very clear that lifting lockdown is not simply like flicking a switch. It will be a gradual, slow, careful process, and some of the measures we're living with right now will continue to have to live with for quite some time to come. But we have to prioritise right now protecting the progress that has been made. I said yesterday, and it remains my view, that we're at a pivotal point where if we continue to stick with these measures, we will see the virus continue to decline and become more under control. But if we ease up now, we will see it go in the opposite direction. And before long, I'll be standing here telling you that we have to impose stricter measures and unfortunately reporting figures that are going in the wrong direction. I don't want at that point, as I said before, anybody in Scotland to be able to look at me and say, why on earth did you start to lift these measures before you were certain that we had the virus sufficiently under control? So I will make those judgments as best I can. I have said all along, and I've said again today, I think there is merit in all 4 nations of the UK moving out of these measures at the same pace, because that helps us with messaging. But if that is the case, then that can only happen if we agree that any changes have to be agreed by all of us. And if we decide that we want to go at slightly different paces, then we respect each other's right to do that. My judgment, though, and my responsibility is to take the judgments that I think are right for keeping Scotland safe. Glenn Campbell from BBC.
First Minister, is lockdown lifting to some extent across Scotland, regardless of any changes announced by government? And if so, are you okay with that?
I don't want us to ease up on these restrictions right now. So the regulations aren't changing. The guidance as of today, whether that is guidance to individuals, guidance to businesses, guidance to wider society, has not changed. I've talked today about one potential change to guidance that we may make in the coming days, but we have to consider carefully what the limitations of that would be and what the clear messaging around that would be to make sure it doesn't have unintended consequences, because clarity of messaging is really important. I do know, because I get messages from people who are worried that the roads are busier, that the streets are busier, that there are some businesses that are not required by law to close but that have done so voluntarily are now starting to reopen. And I've said this week before, I share much of that concern because I know how finely balanced these things are. So as First Minister, I'm saying clearly to the public, to businesses, to everybody, our guidance right now remains as it has been, and that is stay at home except for the essential purposes of exercise right now once a day, getting food and getting medicines, and follow all of the other advice that we're giving. Kieran Jenkins from Channel 4.
First Minister, in England and Wales, carers are included in COVID-19 bereavement payments for workers who lose their lives. In Scotland, they're not. I'd be grateful for a yes or no for the avoidance of any doubt. Do you have the power to make bereavement payments for carers?
I'm not going to give you a yes or no answer to an issue that you've raised with me right now. It's a really important issue, and I want to go and make sure that I know exactly what the detail of that is, and I will then give you an answer. I think on an issue as important as that, it probably will be more than a yes or no, but on the point, what are our powers, we will give you a very clear answer to that. I don't know, Health Secretary, whether you want to say any more about it right now.
The 2 things I'd say is that, as you will know, we have agreed a death in service additional benefit for those in the NHS who are not part of the NHS pension scheme for their families as an initial payment, but also as an ongoing payment. It is entirely comparable with the benefit that is there for those who are part of the pension scheme. We've done that in recognition, of course, of the situation, but also because we are their employers. where care assistants, social care staff, they are not employed by us. They are employed by local authorities and by private providers. And what I have said very clearly is that if those employers want to talk to me about what we have done and what they might do, then I am very happy to have that discussion.
So it's an important question. We will get you a detailed answer. And of course, if there are areas that we require to look at further here, I give an undertaking today that we will do that urgently. Peter,
possible for it to be done in England and Wales, but not in Scotland?
I think what I'm saying, Kieran, and this may, I keep saying this may not be a usual answer for a politician, but I don't know for sure right now what the answer to that question is. So I'm going to go away and I'm going to look at the detail and I'm going to check the answer so that I know the answer I'm giving you is the correct one, rather than trying to pretend to you right now that I know all of the detail of the issue you're raising with me. So we'll come back to you on that as soon as possible. I hope people watching will agree that that is a better approach to try to get to the facts and give a proper, robust answer, even if it takes a little bit longer. But the issue is an important one. Jeane has talked about NHS and people who are employed as carers. We also just yesterday, of course, announced further financial help for unpaid carers through an additional supplement to the carers allowance. So we are absolutely of the view that all of these issues matter deeply right now, which is why it's also really important that we take the time to look properly into issues that are raised with us and come back in detail on them. Peter Smith from ITV News.
Hi, First Minister. Thank you very much. It's been a couple of weeks now since we raised the idea of if you were going to take a different path from the UK, how would policies like, for example, the job retention scheme be paid for? Because currently that's funded by the Treasury down in Westminster. I wonder now that we are at a point where you could be talking about extending lockdown longer than other parts of the UK. You certainly have the powers to do it, but who pays for it?
Well, look, let's see whether there are differences that open up between the position I would take, which I'm not changing my position. If the Prime Minister decides he wants to go at a different pace to others for England, that is a decision he is entitled to take. But I'm commenting today as I think I have to, because people are reading it on media reports. As I said, hopefully I'll be speaking to the Prime Minister later this afternoon, so I'm not going to get further into hypotheticals. It may be that there's not as much difference in our positions as the media today would suggest, but we'll see as the day and indeed the weekend progresses. James Matthews from Sky.
Thanks very much, First Minister. You have stressed the value of a united UK approach today. You've also repeated that this is a life and death issue. If Boris Johnson breaks on Sunday from a united UK approach, is he heightening the risk to life?
Look, if people listen carefully to what I'm saying, and I know people watching this do listen very carefully, what I'm saying is the most important thing, the only thing that matters to me is that we take the decisions that are best going to suppress and tackle this virus and save lives. And I think that's what all of us in leadership positions across the UK are doing. One key point I've made previously this week and I'm making again, and this could be the case within different regions in England as well as between England and Scotland, it could be the case in different parts of Scotland, which is why we have to look so carefully at this data, is that the infection curve is not at exactly the same stage necessarily in every part of the UK. So we think right now our number might be a bit higher than the rest of the UK. So it is entirely possible, because Boris Johnson will, I assume, be looking at the evidence as closely as I am. It is possible that we will arrive at different decisions for very defensible, justifiable reasons, and we'll both be taking the decisions that we think is right based on the evidence. It will be the evidence that is pointing us in different directions. So I think all of us should be guided right now only by what do we need to do, informed by the evidence, to suppress this virus, and that is how I am going to continue to inform all of my decisions. Peter McMahon from ITV Border.
Good afternoon. Good afternoon, First Minister. First Minister, I'm sure you would accept that until you even move a little way on lifting the lockdown, the testing strategy that you've put in place will have to be working, testing and tracing will have to be working properly. This morning, your former Chief Medical Officer, Sir Harry Burns, told MSPs on a committee that she should be testing, and I quote him, the whole of the population. He also said that the current approach of testing is volume rather than quality, the approach, she said, is never mind the quality, feel the width. That's a pretty damning indictment of what you're doing so far, is it not?
I've not heard those comments, but if they are as you report them, I don't agree with them. Everybody knows my deep respect and affection for Harry. He's the Chief Medical Officer I had the privilege and pleasure of working with throughout my time as Health Secretary. So he's somebody I think enormously highly of. But, you know, there are lots of opinions out there, some of which, like Harry's, I will always listen to. Others, perhaps less so. But I have to work with a team that we have in here that is looking at the evidence we have, that is making informed judgments on the basis of that and trying to take the best decisions. We are working on a testing strategy just now that has been developing as our testing capacity increases the quality of that testing. We are using a quality assured test. I'll ask Gregor in a minute to say something about the accuracy of that test, and we're doing that in ways that is driven by the clinical evidence. So the decisions we've taken about extending testing in care homes is very much driven by the advice I've had about the best use of testing. And as we build up that and evolve that into the test, trace, isolate strategy, we continue to take account of the estimates of the volume and the scale that we will need, not just in testing, but in contact tracing to do that. So these are all decisions that are being made.
About testing is there needs to be a reason to test. It needs to answer a clinical question in that respect. So actually, if it gives a positive results, we know with confidence that it's picking up SARS-CoV-2 rather than some other virus as well. So I have confidence in the test that we're using in Scotland.
Tom Eden from the Press Association.
Thank you, First Minister. It's, again, more comments from another expert. I know you've spoken today extensively about another resurgence of the virus. Professor Hugh Pennington said in evidence to a Holyrood committee, I have seen no evidence to indicate that a second wave of cases of COVID-19, more virulent than the one we have endured, would occur if control measures were to be lifted prematurely. Have you got any evidence that a second wave would occur? And if so, can you tell us more specifically what that evidence is?
I think every piece of evidence I hear, both directly within the Scottish Government and from international experts, is that there is a very real risk of a second wave of this infection later in the year, and the scale and the timing of that could absolutely be influenced by the decisions we take in lockdown. I think every country is pretty much alive to that risk as they take decisions. If that wasn't the case, then we wouldn't have countries as gradually and as carefully as they are starting to ease their way out of these restrictions. So I don't know what Hugh Pennington is basing that on. You know, it was put to me last week something he said about the R number in care homes. I have no idea what he was basing that on either. So, you know, there are lots of people out there with varying degrees of expertise about the particular challenge we're dealing with. I think it's important to listen to, you know, lots of different views and opinions on this, but I've got to base my judgments on the advice that is coming to me through the Chief Medical Officer, our own advisory group, taking account of the published and stated opinion of experts more generally, and that's what I will continue to do. Chris Musson from The Sun.
Hi, First Minister. You said you're speaking to Boris Johnson later today, I think. Will you consider relaxing the exercise rule from next Monday if that's what the Prime Minister is considering doing? And can I just check, were you too quick yesterday to rubbish the idea of matching any lockdown restriction by Downing Street, given it sounds like this exercise restriction relaxation is what is being planned?
I don't know if you were on this press call on Tuesday when we published the update paper, but I said then that getting people outside more was something that we were keen to do as soon as possible. So, you know, we have been considering this and we will continue to consider it. We will take that decision based on the considerations we do, and we will do it on a timescale that those considerations tell us is right. If we can come to an agreement across the four nations about the timing of that, all well and good. I think that would be preferable. But I think we have to, all of us, come to these decisions on the basis of the advice we've got, and that's what I will continue to do. And I'm, you know, people, I know there's, because I get lots of message of people watching this press briefing. This is the advantage of doing this every day. People can hear day by day how our thinking is developing. Sometimes our thinking has to go back the way as new evidence emerges. Sometimes we can accelerate certain things, but people hear and have heard over the past couple of weeks just exactly what it is we're thinking of. So I would encourage people to keep watching for that reason. Michael Blackley from the Daily Mail.
Could it be Monday for the exercise relaxation?
Chris, I'm really not sure what bit of this is difficult to understand. It could be Monday if the evidence and the advice tells us that's the right timescale. If it doesn't, I won't be pressured into doing that because somebody else, perhaps perfectly justifiably, thinks it's the right timescale for the population that they are making decisions for. My decisions will be evidence-based, and I don't actually think I can be much clearer than that on these questions. Michael Blackley from the Daily Mail.
Hello, good afternoon. If this relaxation on outdoor exercise does come into force from next week, could it potentially include people being allowed to sunbathe if social distancing takes place, or to have a picnic on the beach? And also, could they be allowed to do things like golf, fishing, tennis as well?
So the reason why we have to consider this carefully is so that we are able to answer all of these questions. And I don't want to sort of allow people to run away with expectations before we are able to say, okay, this is okay, we don't think this would influence the R number, but this might be less okay. Now, right now, what we are considering is an extension to the once a day. So once a day, you can go out for exercise, stay close to your home, stay within your own household group or on your own. You don't have to take your whole household with you when you go out for your exercise, but stay 2 metres away from everybody else. We're not saying to people that means you can go and congregate in public places as part of that. So it's looking at raising the frequency of that. But of course, we will consider what the parameters could safely be as part of that consideration. And the reason we do these things really carefully and consider them carefully so that when we give advice, we're given clear advice that people can understand. Because if people have confusion about what the advice is, then they're less likely to comply with it, not because they willfully don't want to comply with it, because they don't understand what we're asking them to do. And, you know, that's, of all the stuff I've heard in the media today, the one thing that concerns me most deeply is the suggestion that as of Monday, the UK government in England, or any suggestion this would happen in Scotland, would lift the stay-at-home message. Because people understand that apart from some limited exceptions, and over time we might increase what those exceptions are, but right now it's stay at home. Now, unless you're really clear what you're replacing that message with, what you risk is confusion and people ending up not complying because they don't understand what we're asking you to do. So clarity of message here is really, really important. Derek Healy from the Courier.
Thanks, First Minister. What happens in the rest of the UK obviously has an impact on Scotland as well, with movement of workers and goods and so on. We've seen some concern today at the prospect of easing restrictions when the UK has among the worst death rates in the world. Having seen a draft version of the Prime Minister's plan earlier this week, and with what we've seen reported today, how confident are you that these measures wouldn't also put the people of Scotland at greater risk?
Well, I think you can take from what I'm saying here is that much of what has been reported in the media today, and if you've seen a draft of the Prime Minister's plan, you've seen more than I have, because I haven't seen a draft of the Prime Minister's plan, and I'm very clear that I want four nations decision-making, but four nations decision-making has to be all four governments discussing and agreeing. It cannot be one government deciding and the rest of us simply being expected to fall into line. So I'm very clear that what I have read in the media today, at the stage we are at, and with the evidence we have about the infection rates and the R number, those changes would not be safe to make in Scotland, with the one exception that I've spoken about already about outdoor exercise, which we are considering. So that's my clear view. And if we want to continue to do things, I said this in Parliament yesterday, if it is the case that different parts of the UK might be at a slightly different stage of the infection curve with slightly differing R numbers, if we want to continue to do things at the same pace, that is possible, but it means all of us going at the pace of the slowest of the country that still has the highest infection rates, because that's the only safe way to do it. If you do it the opposite way, where countries that are still at a higher level with an R number have to go at the pace of the fastest, that's when those countries end up taking, in my view, unacceptable risks. So it is possible to do things at the same pace as long as we agree that we only make changes that each of us are satisfied are safe. Scott McNabb from the Scotsman.
Yeah, First Minister, you've talked about how you respect Boris Johnson's right to do things his way in England if he feels that's the right way to go. But given there's been a four nations approach so far, are you concerned about the way that he's handled it? If there's media leaks before he's spoken to you, is that disrespectful? And also, just to be clear on something I think you hinted at earlier on, if there is a different approach in England, are you concerned that that could undermine the clear public health messaging that we've had so far?
I would rather the public health messaging was consistent across the UK, but and I think we would all four of us, the Prime Minister, the three First Ministers, would be in the same position here. We'd rather the public health messaging was consistent, but I don't want to move to a public health messaging that I think is wrong just because others want to do that. So my view, we should stick with stay at home for the foreseeable future. In relation to your last question, I keep saying this because it is true. Politics right now, if we were standing here talking about another issue, about the dreaded Brexit or something like that, then perhaps I'd be more willing to get into some of this. I'm not interested in the politics or the personalities here. I'm simply interested in us doing the right things. I think it's reasonable, and people will understand that I'd rather not be reading about UK government plans in the newspapers. I'd rather not be seeing the front pages at midnight and that being the first I know of what they are planning. And I hope over the next couple of days we can get back to proper discussions of these things, and then we can decide, in an entirely grown-up way, whether we are all at different stages and want to go at a slightly different pace, in which case we can agree the coordination of that, or we agree that we all go at the same pace because that makes for simpler, more clear public messaging, but we accept that that means, as I said a moment ago, going at the pace of the slowest. These are discussions all of us, I'm sure, are perfectly capable of reaching in a proper, grown-up way, and I hope that's what we get to over the next couple of days. Alistair Grant from the Herald.
Hi there, thanks very much. You said you'd rather not read about Boris Johnson's potential plans on the front page of the newspapers. Will you be raising your unhappiness at that with him directly later on in the phone call? And if I can just ask as well, I think research today from a team at Glasgow University suggested that obesity doubles the risk of needing hospital treatment for coronavirus. Is there any update on when we'll get data on COVID deaths by factors such as obesity or ethnicity in Scotland?
I'm going to hand over to Gregor on that point. On your first point, look, I'm pretty sure Boris Johnson, I'm not suggesting he'll be watching right now, but I'm sure he'll hear, as I hear what the UK government says in their press briefings. I will not be, I don't want any discussion I have with the Prime Minister right now to be based on disagreements. I want us to just discuss what is best for all of us to do to beat this virus, and that's what the conversation this afternoon will focus on. Gregor, do you want to say something about the data?
So in the UK data that Scotland feeds into, we've got units in Scotland that feeds into the collection of this data just now, and we are getting signals through in some additional risk factors that are being identified. And as you've pointed out, obesity appears at the moment in time to be giving us a signal that it could be an additional risk factor. What we don't know at this stage from the data as it's collected just now is the degree of obesity. A lot of the measurements that have been taken from this haven't been from a formal clinical assessment, but really a subjective analysis rather than anything else. And that needs to be understood in a greater amount of detail before we can really say that this is something which is substantiated or not. But certainly there's a signal that's coming through there that appears to be important. We know a little bit more about the influence of race and ethnic origin on the particularly the mortality rates just now, and what was again appeared to be an excess of mortality. We've drilled down in a lot more detail to try to understand exactly what the other factors which might be influencing that is. Now, even removing some of those other factors which account for some of the health inequalities and other conditions that people face from some ethnic backgrounds, there does seem to be an increased risk to an extent in the UK data just now. And over the next week, what we hope to see is data which will be published by Public Health Scotland, which will give us a much clearer sense of what how this relates specifically to Scotland.
Thank you. Mark McLaughlin from The Times.
Hi there. Maybe one for the Chief Medical Officer. In a letter to The Lancet this week, Johan Giesecke is a Swedish epidemiologist who sits in the World Health Organization's advisory group for infectious hazards, said the UK's hard lockdown will not protect the elderly in care homes and it will not decrease mortality. And he planned Sweden's light touch restrictions, which kept schools and workplaces open and maintained NHS capacity. He reckons that a quarter of people in Sweden have already had it, 99% had no symptoms. He reckons most people in the world are going to get it anyway, and it's going to outrun any vaccine or drugs, so we can't just sit this out. This is a quote from his letter. He said, "Lockdown might delay severe cases for a while, but once restrictions are eased, cases will reappear. I expect when we count the number of deaths from COVID-19 in each country 1 year from now, the figure will be similar regardless of the measures taken. The lockdown only pushes severe cases into the future and will not prevent them." What's your response to that, Chief
The
Medical?
substance of that question is for Gregor. All I would say as an observation is I think during the questions so far today we have had demonstrated that there is a whole range of expert opinion that we can read and hear about, not all of it saying the same things, which is why we have to work through these things so carefully. Gregor.
So I would acknowledge that Sweden have adopted a different approach from other countries in Europe, and that's right for them. They've assessed that that's the right approach for the kind of culture and circumstances that exists within Sweden. The weight of scientific opinion from other countries certainly appears to suggest that there is a very real need to suppress transmission of this virus very quickly, and in advance of any other measures such as either pharmaceutical measures or vaccines which might come and start to influence the longer term impact of COVID-19. And I think the really important thing is we need to do what's right for our circumstances, and it's been assessed in the UK that actually suppressing the virus to this level in combination, I think this is really important, with the shielding that has been put in place to try to protect those who are more vulnerable is the right method for us to take. We'll continue to watch with interest what other countries are doing around the world. We will learn where that's possible from their experience, but we need to make the decisions based on the science that's right for this country.
Thanks. Vivian Aitken from the Daily Record.
Good afternoon, First Minister. This morning I spoke to Dr. Hans Kluge, the European Regional Director of the World Health Organization, and I asked him about the possibility of different parts of the UK easing lockdown at different times. He told me that it was perfectly possible to have different timings, but said it was important to look across the borders, particularly if traffic is going to be increased. So can I ask, have you entered into any discussions, or will you enter into any discussions today with the Prime Minister about controlling borders between Scotland and England if he heads towards lockdown easing as expected this weekend?
That's not something I anticipate discussing with the Prime Minister today, no, but we will focus on what is right and what is not right to continue to suppress this virus. I certainly do think and believe that the UK government is looking at measures that may need to be stricter in terms of international borders and the requirements on people coming into the country. Simon Johnson, The Telegraph.
Regardless of the fact that a lot of these decisions are devolved, are you concerned that the Scottish people may pick and choose the advice that they want to follow depending on their personal opinions? So those are more cautiously minded go along with your advice. Those are maybe a little bit more gung-ho and are frustrated by the lockdown follow what they see the Prime Minister saying on Sunday. And we actually get not just a fracturing between Scotland and England, but within Scotland about people's behaviour.
Well, I think we have to continue to work to get messages across and persuade people to comply with the advice. And I think that is the case regardless of what might happen over the next few days. I I'm never complacent about these things, which is why I stand here every day and try to explain the reasons that we're asking people to do certain things, because I believe that is the basis for good compliance. But I have been hugely heartened and encouraged and with the compliance so far. We do, as I'm sure all governments across the UK are doing, opinion tracking to understand whether people are trusting the messages we give and complying, and the levels there are very high. So we will continue. My approach is going to be, for as long as it takes, this may or may not fill you with joy, but for as long as it takes, to stand here every day and as clearly and as rationally as I possibly can set out the basis for the decisions we're taking, the conclusions we are reaching, why we're asking you to do certain things, and in doing that, I think I've got a better chance of persuading you to do these things, and I will, as I say, keep doing that for as long as I think it is necessary. Andrew Learmonth from the National.
Thanks, First Minister. Extending the lockdown for 3 weeks is clearly going to have a huge impact on the mental health of a number of Scots. I appreciate that the Cabinet Secretary said earlier this week that if someone asks for help with their mental health, then help will be there. But as we know, a number of people who struggle with mental health don't necessarily ask for help. So firstly, can you say how you're able to reach those people, and are you doing anything to try and contact people who might be in touch with services previously but might now have fallen off the radar? And secondly, the Mental Health Foundation has today published a number of recommendations for helping people's mental well-being as we get through coronavirus. One of those is for central government to work with local authorities to stop sending out debt collectors for unpaid council tax and to start offering payment holidays on rent and council tax. Is that something you would look at and something you'd support?
I'm going to hand over to the Health Secretary to answer that question.
So I've not seen the report from Mental Health Foundation, but we will look at all the recommendations they're making. I would expect, because we've worked in close collaboration with a number of mental health organisations, that many of the measures we've already put in place will accord with many of their recommendations. And one of the things that I said today was, of course, as you know, over a number of weeks during these briefings, we have from time to time spoken about new support to help people with their mental health and well-being. And because of our current lockdown, much of that is available only digitally. It could be through FaceTime, but it is also online. And so the announcement I've made today was very specifically addressed at those individuals we know who are not yet online and don't have either the equipment or the experience or the confidence to access that important digital world. In addition to that, we've also, my colleague Ms Hockey in Parliament only the other day set out very clearly what our mental health services in the community have been doing in order to ensure that people they were working with, that they could continue with that work and there would be no break in doing that. Again, that is done primarily digitally, but it is a way in which the feedback coming to us so far is that people welcome that very much because they're not losing that connection. In terms of people that it is difficult to reach, and I do very much understand how hard it still is for many to acknowledge in a more public way that they are struggling. I so hope that is getting easier for more and more of us, but it's still difficult for many. Sometimes they have other difficulties, problems they're addressing, could be alcohol, could be drugs, all of it bound up together. And so all of the work we're doing is to try through various routes to still reach those individuals. And most importantly of all, to say to them, as we say to our young people, it is okay not to be okay. And the support and the help is there. We will keep trying to make sure that we reach as many people as we possibly can with what is vital and helpful support.
Thank you. Severin Carell from The Guardian.
Thank you, First Minister. Just going back to the press reporting of what is anticipated the Prime Minister will talk about on Sunday, the reports that he is thinking of allowing people to start playing golf again or going fishing or allowing outdoor cafes to reopen are from pretty reliable media. Now, given the fact that you are pretty resistant to going that far, isn't there a clear risk of some public order problems in Scotland? And given that, have you discussed this with the Chief Constable, or are you going to consult him about whether or not Scotland ought to match England?
We discuss these issues on an ongoing basis with the Chief Constable, and as we consider our own progress out of lockdown, issues around enforcement are very much relevant matters, and because we've always been aware, and I'm not talking about Scotland-England differences here, I'm just talking even within Scotland, that as these messages over time become more nuanced, then the issues around enforcement potentially become much more difficult. So these are issues that we are constantly talking to the police about. I think, and I'll be corrected if I'm wrong, I think the Chief Constable is due to join me again at one of these updates in the near future, so I'm sure these will be issues that he is able to give a view on as well. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Just a question on the data, perhaps the CMO might be able to elaborate a little bit on. Obviously, we've heard again today and throughout the week about this potentially slightly higher R number. Are we able to tell from the figures we're getting in of how much of a lag there is with the rest of the UK? Back in April, for example, I think there was some work came out of Edinburgh University suggesting Scotland was 6 to 7 days behind London in terms of spread of infection. So I just wondered, from what the data coming in, are we able to tell how far behind we are, and how does that feed into the sort of decision making that's going on?
Gregor.
So what I would caution there is I would caution to think of this in terms of a very simplistic argument about lag just by itself. There are numbers influenced by too many things just to simplify it in those terms. There's no doubt that it could be contributing to it at all, but it's also contributed to by a variety of other things, such as, for instance, just what proportion of the country remains susceptible to kind of infection by the virus, how many bridges or chains of transmission are built between people through contacts. There's all sorts of things that begin to influence all like that. So, as I say, I don't think that we could say from the data just now with any degree of confidence that we're a certain period behind other parts of the country. What we can say is that from the modelling that we're doing just now and the results that we're getting from that is that the R number in Scotland does appear to be just a little bit higher than in other parts of the UK, and that's something we need to take notice of and need to make sure that all of us are doing our part to make sure that we try to drive that number down lower, and we make sure that the incidence of new cases of this infection are as low as possible.
Thanks. David Goodwin from the Greenock Telegraph.
Good afternoon, First Minister. We've highlighted today a very serious situation in Inverclyde with Harbour Authority appeal ports intending to dock up to 12 cruise ships at Greenock to allow thousands of crew to come ashore for onward travel to transport hubs, including Glasgow Airport, and for onward repatriation. The Council here and the Health Board are unanimously opposed due to health concerns, the fact that we have the highest COVID death rate in Scotland, and that it will put additional pressure on the NHS and the Council at a time of crisis. It's also been stated in an official Council paper that this has been done for commercial advantage and that it goes against the whole ethos of lockdown and discouragement of non-essential travel. The Scottish Government has the power to suspend port activities here in Scotland. What is your Government's position on this matter?
I have an awareness of this, although forgive me if I don't necessarily have all of the details before me right now. I would say, and again, you will obviously have the detail in front of you, so you will correct me if I'm wrong about this, but I'm not sure thousands of crew would be correct in terms of the numbers of people that are on these cruise vessels, but that is not material to my answer. Look, we absolutely understand the concerns that the Council and the Health Board would have here. We have to absolutely make sure that public health is a requirement and that we don't compromise on that, given what we are seeking to do and asking everybody else to do to suppress this virus. The other side of that is if there are people out at sea, they can't necessarily be left out at sea on a boat for an indefinite period of time. So I know there are discussions ongoing about how this issue can be safely resolved, and that may well require testing or isolation for the people who are on board. But I think it's important that these discussions progress and that they are absolutely driven by public health and public safety considerations. Tom Magner from Carers World Radio.
Thank you very much indeed, First Minister. Viewers certainly welcome your announcement on carers allowance for the financial part of things. But on a practical level, we're hearing from local authorities across Scotland and also in the other home nations that they have spare capacity on their home support services for unpaid carers. Do you think there's scope, without releasing the lockdown, to take up more of this capacity, and how would you propose to do that, if so?
Okay, I'll hand to the Health Secretary, who's been spending a lot of time on these kind of issues.
So forgive me, I'm not quite clear. Is it spare capacity at local authority level that you're asking about? To
That's
support
our
unpaid
understanding.
carers?
That's our understanding, yeah.
Thank you for that. Thank you. So I discuss with my colleagues in the Convention of Scottish Local Authorities every week where we are and they are in providing support to people in the community, not only care at home support, but support for other vulnerable adults. And of course, our overall shielding programme provides a great deal of support. Now, at this point, I'm not aware that any of the carer organisations in Scotland have raised this particular issue with me, but I will now raise it with them and ask them for their particular views on that, so that when I do have those weekly discussions, and of course they can be more frequent, with the Convention of Scottish Local Authorities, we can look and see what more support could be offered to unpaid carers in particular. In addition, as you'll know, I think about a week ago, we made it clear that they should be able to access personal protective equipment through those local hubs in each local authority area. And at this point, 66,000 pieces of PPE have been distributed, and more will continue, of course, as more continue to access it. So we're very keen, in addition to the extra supplementary payment, to do everything we can for a body of people for whom the care, the support and the love they give to those they look after, we can never truly repay.
Okay, thank you. And the last question today comes from Kenny McBride from Broadcasting Scotland.
Thank you, First Minister. Countries like the Faroes were able to quite rapidly scale up their testing capacity by adapting veterinary labs. I wonder if that's something that's been considered in Scotland, and if it has, could you just say a bit about that and when that might be a possibility?
We have also rapidly scaled up our testing capacity. I gave the figures on that last Friday. I remind you, we went from at the start of this outbreak to having an ability to process 350 tests a day to the situation now where it's over 8,000 a day, soon to be 10,000 a day, soon to be 12,000 a day, and rising beyond that. So we have been able to put more equipment into NHS labs. We had 2 of these labs at the start of this outbreak. There's now 1 in every health board area. We have the Glasgow University capacity, and we are continuing to explore academic and commercial partnerships as we go forward. But I'll ask the Health Secretary to say a word more about the work that is underway.
And that exploration includes our veterinary labs as well as other agencies of government, for example, Marine Scotland and so on. What we have to be sure of as we continue that expansion, as we have made sure, as we've brought very helpfully, we are grateful to them, Edinburgh University, Aberdeen University, and coming soon Dundee University into this effort, and they will scale up their efforts in that area as well. We need to be sure that they have the equipment that is needed. That's not just the machine, it's also the chemicals that go with that machine and so on. And so again, my colleague, Mr. McKee, who has assisted significantly in terms of the supply chain for PPE, is now engaged in looking at the supply chain, not just right now to help us continue that escalation of capacity, but looking right the way through, because test, trace, isolate and support will be a significant part of our overall strategy for some time, making sure that the supply chain is as robust and long-term as we can possibly manage it. So as we increase the capacity and more organisations, both public and private, join with us to do that, then we will make sure that you're updated on who those are.
Okay, thank you very much to all the journalists who joined us today. My thanks to the Chief Medical Officer and the Health Secretary, and to Yvonne, our sign language interpreter, for being with us today. And thank you to all of you. Can I alert you, particularly the regular viewers amongst you, that because of tomorrow's VE Day commemorations, the daily update from us will take place here at 1:30 rather than 12:30. So I hope you're able to join us then. We'll update you further tomorrow throughout the weekend, but please, for now, keep complying with these restrictions, because as you've heard today, it is helping us to suppress this virus. And the more we do that now, the further we can suppress the virus, the earlier we will get to a stage where I'm talking much more about how we are, albeit slowly, gradually, in a phased way, easing some of the restrictions that we're living with just now. So thank you very much for your cooperation, and I will see you here tomorrow.